Today we're talking about administering insulin to your pet. You will be provided with a handout that talks about the proper storage, choosing a syringe, drawing up the syringe, and administration. First, talking about the storage of insulin. Depending on the product, you may have to refrigerate it, or it may be left at room temperature, and you need to read the provided pamphlet for proper storage. When choosing a syringe, it is important to know that insulin products have specific syringes that go with the products. The available syringes are a U100 or a U40, and it is important to make sure that you're using the proper syringe with the proper insulin product. For example, this is a 40 units per milliliter product, and so you will want to choose the U40 syringe.
When you are going to draw up your insulin, you need to remember that insulin comes in suspension, so you need to gently mix it by rolling it in your hands. Once it has been mixed, you take your syringe and you hold your insulin bottle upside down. You'll remove the cap, and you'll gently place the needle into the rubber stopper at the bottom of the bottle. You'll then slowly remove the appropriate dose that's been prescribed to you. If bubbles appear, you can gently tap until they go to the top, and you can push them back into the bottle. Once you're done, remove your syringe, and you're ready to administer it to your pet. To properly administer insulin to your pet, first place your pet on a stable surface. Some pets, depending on their temperament, may need another handler to help you hold the animal while you give the dose. So to begin, pet your pet over where you are planning to give the dose. Right today we're using over the shoulders. Tent the skin with your index finger and your thumb. Take your syringe and make sure that you have the correct dose prescribed to you by your veterinarian. Remove the lid and place the needle in the tent, into the hollow space, not in between your fingers. Pull back and observe for blood. If there's blood, take the needle out, recap your needle, and discard it. Redraw up then your same dose with your insulin bottle and your needle, and then re-administer as shown. So take the cap off, tent the skin, go right into the hollow space between the two flaps of skin, and pull back. If you don't see blood, you can push forward and administer the insulin. Gently pull out and rub over the area where you just administered insulin to your pet. Recap the needle and also dispose this in your biohazard sharps container. Always remember to reward your pet after each insulin administration, so it is a good experience.
Now we're going to review some key points that may be helpful with your administration. Always remember to reward your pet, so that is a good experience every time. Also, always make sure you have the proper syringe with the proper bottle. And when you draw up your dose, make sure that you have the proper amount. If a dose is missed or you don't give the full dose, you don't want to administer another full dose or any dose at all. You want to wait until the next meal time for the next administration. This is because you don't want to make your pet hypoglycemic. So, signs of hypoglycemia include acting drunk, seizures, lethargy, or profound weakness. If this occurs in your pet, you want to immediately feed the pet if the pet is willing or able to eat. And if your pet is not willing or able to eat, you can administer Caro syrup. And to administer Caro syrup, you can put it in a dosing syringe and administer between the cheek and the teeth. And if that's not working, you can actually put some Caro syrup on your finger and place it in on the gums of your animal. But you want to be careful if your animal is seizuring or in any other circumstances that you do not get bit.